Mayong buntag ma'am, ako di ay si Shaira Tan, CIM Clinical Clerk. Pwede ko mangutana sa imong pangalan? Norma. Sir, mag-explain ko nimo kung unsa tong buhaton karon, so mao ni ang gitawag nga chest tube thoracostomy. So na ako isud nga tubo sa imong baga. Karon kan imong baga kay naa may fluid sa sulod, so tabang ni ang imuhang tube nga magawas ang tubig, so mag-make kog incision. Kani siya makatabang nimo ni siya para magawas ang fluid ug makatabang nga makaginhawa ka og tarong. Possible complications ani kay pwede ta magka-infection or naay maigo nga organs dito nga maka-cause og bleeding. Pero ma'am, ato ning paningkamutan nga dili ni mahitabo. Naa pa ba tay lain nga mga pangutana? Wala ra do. Okay ra ba nga mo-proceed ta ani? Okay ra do. Abduct arm on that side to facilitate placement by opening the rib spaces and to assist with landmark identification.
Identify fourth or fifth intercostal space at the anterior to midexillary line, approximately level of the nipple and insertion at the lateral breast. Cleanse skin with betadine.
Do a wide skin preparation. Include the sternum, clavicle, and subcostal areas.
Inject lidocaine.
Check for the anesthetic effect.
Place sterile drape. Centimeter incision through skin and into subcutaneous tissue. Position hemostat above the rib to prevent damage to the neurovascular bundle that runs below it with firm grip and pressure puncture at the intercostal muscle using curved hemostat. Insert finger to identify passageway, make sure in thoracic cavity. Palpate lung during respiration.
Further enlarge opening in pleura using large caligram.
Measure chest tube to level at the clavicle to note expected depth. Clamp pointed end to control any leakage blood or fluid upon tube insertion. Use curved hemostat to assist with directing tube into newly created defect in the chest wall. Sweep finger around tube superiorly and inferiorly after placement to ensure tube enters the thoracic cavity. Suture is passed using a purse, string, or horizontal mattress stitch around tube to close wound margins around tube. Pull two ends of suture to equal length and remove needle from the field. Tie suture in place tight to the skin. Wrap ends in opposite directions around the tube to form a series of X's. This is known as your Roman saddle or Chinese finger trap configuration. Push suture down to skin edge before tying suture again to prevent slack from being incorporated into the suture. Wrap tube with Vaseline impregnated gauze and push it up against the wound margin to prevent air leak. Tube side is covered by 4x4 gauze and the cuts lead into the center of the gauze and place two pieces, one with 90 degrees relative to the other to prevent gauze sliding off. Gauze secured the skin by tape. Just X-ray to ensure adequate placement of tube.
Ma'am, mananadate sa procedure. So, successful na data. Wala rin naigo ng mga organs. And then, sakto ra ang tube para ma-drain ang atong fluids na sulod sa baga. Mag-observe ta ani for pila ka days. Hangtod nga mahurot o drain na ang tanang fluid. Nga, tagaan na ka na mag antibiotics o para pain relief ani ma'am. Nakapabatay lain ng mga pangutana.